Hello everyone, this video will be about familial hypercholesterolemia. With this video, we are starting a series of videos on YouTube about different medical conditions. The videos will be short with the brief informations, the most important, and at the end there will be an example of a question which you can come across on different medical exams. Okay, without any further delay, let's start. So the first, which is quite important to know about familial hypercholesterolemia, is that it is an autosomal dominant disease. Allow me to write it down for you. Okay, so autosomal dominant. The other thing is that it is quite a common condition. It affects about 1 in 500 people. Okay. The main cause of familial hypercholesterolemia is mutation in LDL receptor protein. Okay. Those receptors are usually located on the hepatocyte membranes. When there is this mutation, it means that there is a smaller number of properly functioning LDL receptor proteins on the hepatocyte surface. In other words, less LDL can be absorbed, can be taken up by hepatocytes because of defect receptors. In the result, you will see increased level of LDL in the bloodstream. Okay, now let's turn to the specific features. A very specific feature for familial hypercholesterolemia is lipid deposition under the skin. And I have here 4 pictures, which are the best examples how it can look like. So the first one, you have an eye, and under this eye, you can see that there is like this sort of the yellow plaque, okay? And the name of that is xanthelasma, and this is a lipid deposition under the skin, under the eye. The other example of xanthomas, because all of them are called xanthomas, so lipid deposits, are those yellow plaques on the elbow and here on the Achilles tendon. In those 2 pictures, you can see that these yellow plaques overlie tendons, and it is very specific because the other tendons location where you can find those deposits are knees, knuckles on the hand, The other very specific deposition can happen on the palm, and usually it overlies the palm crease. So as you can see, for example, here and here, and also you have a fingers, and where the crease are, you have like those yellowish plaques here. A part of xanthomas, so we have xanthomas, familial hypercholesterolemia is also characterized by elevated LDL and total cholesterol. The next thing is that it usually happens in young people, so less than 30 years. Less than 30 years old. Okay. To make diagnosis of familial hypercholesterolemia, we use Simon-Broom diagnostic criteria. And I have them here. So as you can see, to make a definite familial hypercholesterolemia diagnosis, a patient needs to meet one of those two. So cholesterol concentration should be raised. Total cholesterol in adults should be more than 7.5 mmol per liter and LDL more than 4.9 mmol per liter. In children, it will be 6.7, more than 6.7, and LDL more than 4. A part of the raised cholesterol levels, there will be some tendon xanthomas or evidence of these signs in first or second degree relative. The second criteria to make a diagnosis of definite familial hypercholesterolemia is DNA-based evidence of LDL-C receptor mutation. So, if a patient is certain that someone in his family, like mother, father, or siblings, have been diagnosed with familial hypercholesterolemia, they are at risk that they also can have this condition, and they can have this genetic test, and when it's positive, it means that they also have this definite familial hypercholesterolemia. To diagnose a person with possible familial hypercholesterolemia, again, a patient has to have raised total and LDL levels, same as indefinite familial hypercholesterolemia, and also in the family history they are aware about someone who, for example, was younger than 50 years old and they had myocardial infarction, and it is about in someone who is the second degree relative, or someone who is the first degree relative, younger than 60, and also had some sort of the cardiac event. So this is the first criterion. The second criterion describe raised total cholesterol as in table 1 in a patient whose first or second degree relative also had raised cholesterol. So the investigation for familial hypercholesterolemia So we have familial hypercholesterolemia investigation. So it will be physical examination. By this I mean skin inspection to look for xanthomas. It will be thorough history taking, focusing on family history to see if a patient has anyone in a family who had either diagnosis of familial hypercholesterolemia or they had someone who had a cardiac event and they were younger than 50 years old. If it's about a second degree relative, or younger than 60 years if it's about the first degree relative. So family history. And lastly, lipid profile. Okay. How do we treat? So obviously, lifestyle advice. If someone is smoking, we advise to stop smoking. If someone is drinking alcohol, to stop consuming alcohol. If patient is obese, so diet, physical activity, and weight reduction. We also start a patient on statins. Statins are this kind of medication which inhibit 3-hydroxy-3-methylglutaryl coenzyme A reductase. So they reduce the amount of endogenous cholesterol synthesis in the liver. So they reduce synthesis of cholesterol by the liver. And here we have an examples of statins: atorvastatin and the alternate rosuvastatin. If a patient develops side effects or they do not meet cholesterol reduction target, then we prescribe asymptomatic. So if in here side effects, 2 statins, or did not meet cholesterol target reduction. Asymptomatic is a cholesterol absorption inhibitor, and it is very, very effective. The alternate to it is alirocumab, which is a monoclonal antibody agonist, PCSK9. It is also a very effective medication, but the disadvantage of alirocumab is its price, because it is expensive, and it's given by injection every 2 weeks. So it is a bit inconvenient for a patient. If after introducing of those medications there is still no reduction in total cholesterol, it means that maybe patient may not be compliant with medication, and maybe he did not follow lifestyle modification advices. So it is worth to check it with the patient again. But usually after even introducing the first line treatment medication statins, there should be visible reduction in LDL and total cholesterol. Okay, so I think we covered all of the most important information. As you can see, it's a very simple topic. So let's have a look at this case. We have a 29-year-old woman booked an appointment with her GP because she noticed some skin changes on her face that do not resolve. So we have a pretty young lady, 29-year-old. Okay, let's see what these changes are. Her skin changes are. After thorough examination, you know that she has a few yellow plaques. Okay, few yellow plaques about 2 to 3 millimeters just below her both eyes and on the right elbow. Okay, so we expect that she has something like this on this first picture, and also here elbow. Okay, let's go back. Okay, here. Otherwise, she is asymptomatic and her physical observations are in range. Looking at her case notes, you have learned that she doesn't have any other medical problems, doesn't take any regular medications, and the last blood test results, which were done 5 years ago, so quite a long time ago, were normal. So you asked her to repeat blood tests, including repeat profile. This is her blood results. So we have high density lipoprotein, HDL, which is normal. We have LDL, low density lipoprotein, which is high. Triglycerides, again normal. So I will put N next to it. Okay, so it's normal. And total cholesterol is 8.2 mmol, which is again high. Okay, let's go back to the Simon-Brome diagnostic criteria. to compare these results. So we know that she's 29 years old, so she's an adult, and her cholesterol was 8.2. Okay, 8.2. And in the criteria for definite familial history, the total cholesterol should be more than 7.5, so it's 8.2. LDL, it is 5.2 millimole. Again, it's more than 4.9. So she meets this criteria about cholesterol concentration. What else they say? The patient should have attendant xanthomas. She has under eyes, and elbow, or evidence of these signs in first or second degree relative. We don't know anything about her relative. There is no information whatsoever in this case about her family history. So we can say about that. But from all of those, these two, cholesterol concentration and tendon xanthomas are present. So they point towards the definite familial history hypercholesterolemia. So as you can see, it is it's very, very straightforward, a simple case. Usually cases for familial history are quite simple because they need to point you toward the answer. So either you will see that there is some yellow plaques on the tendons or under the eyes, and they usually will give you the lipid profile. If you will notice that LDL and total cholesterol, both of them are raised. So from the history and from the blood results, this patient meets criteria for familial hypercholesterolemia. Okay, so that would be it for now. I hope that you enjoyed this video, that you will find some useful information. If you have any suggestions or questions for us, please write in comments. For now, I'm saying goodbye and bye-bye.